Welcome to this comprehensive professional development module, thoughtfully designed for special educators, classroom teachers, therapists, school counselors, and inclusive coordinators, focusing on effectively supporting high school students with profound locomotor disabilities. These high school students experience extremely limited voluntary movement in their bodies, which means they require full physical assistance from trained adults for all aspects of mobility, transfers between positions, careful positioning throughout the day, and intimate personal care routines. In addition, they often rely on complex assistive technologies, such as advanced communication devices and adaptive learning tools, to express themselves and engage in education. Our primary focus must always be to support their physical comfort, ensure their safety, promote active participation, nurture emotional well-being, and preserve their inherent dignity at every single step of the process. High school students with profound locomotor disabilities typically have no independent mobility whatsoever and depend entirely on specialized wheelchairs or advanced positioning devices to maintain their posture and navigate their school environment. Because of this, they require constant, vigilant adult support for all movement, precise posture adjustments, and smooth transitions between activities, while also often exhibiting limited control over their head and limb movements. Furthermore, these students can readily experience significant fatigue from daily efforts, chronic pain from positioning challenges, or various medical complications. And they frequently use augmentative and alternative communication methods to clearly express their personal needs and preferences. A crucial key insight for all educators and support staff to embrace is that intellectual ability among these students may vary widely, but their physical limitations in no way indicate any cognitive inability. Therefore, we must always presume competence and treat them accordingly. When supporting students with profound locomotor disabilities, safety must always remain the absolute highest priority in every interaction and procedure we undertake. Practical strategies to uphold this include closely collaborating with experienced physiotherapists to develop highly personalized positioning plans tailored to each student, and carefully scheduling all transitions with fully trained staff who utilize proper lifting devices for secure handling. It is absolutely crucial to ensure that accessible emergency evacuation plans are firmly in place for every school area and to establish structured daily mobility routines specifically designed to help reduce fatigue and prevent overexertion. For instance, implementing a structured, safe transfer simulation training session allows school staff to practice essential techniques alongside therapists, building proficiency, confidence, and a shared understanding of best practices. Achieving optimal comfort is profoundly significant, as it directly impacts both learning engagement and the overall well-being of students with profound locomotor disabilities throughout their school day. Highly effective strategies encompass utilizing fully customized seating systems with targeted supports for stability and proactively repositioning students at regular intervals, every 45 to 60 minutes, to effectively prevent discomfort, pressure sores, and postural issues. It is equally important to proactively create dedicated calm rest opportunities in quiet spaces and to continuously, attentively monitor for any subtle pain cues or signs of distress that the student might display. A practical example of this in action is implementing a regular comfort check routine that leverages the student's AAC device, empowering them to directly communicate their current comfort levels and needs to caregivers. Facilitating meaningful participation is absolutely vital for the academic and social growth of students with profound locomotor disabilities in high school settings. Key strategies to enable this include thoughtfully utilizing AAC devices, adaptive switches for control, and cutting-edge eye gaze technology for interaction, as well as providing simple yet effective yes/no cards for quick, reliable responses during lessons. Furthermore, designing inclusive classroom roles that specifically rely on the student's decision-making abilities, such as a dedicated, choice-making role facilitated through AAC, truly empowers them and fosters a sense of agency. Adapting the curriculum in targeted ways is essential to ensure full academic participation for these students within the high school environment. Effective strategies here involve providing accessible digital and audio formats of the curriculum materials, allowing responses via verbal expression or AAC methods, and incorporating flexible, individualized breaks to maintain focus and prevent fatigue. An inspiring example is developing a personalized digital learning portfolio entirely created via the students' AAC inputs, which beautifully showcases their academic achievements, progress, and unique contributions over time. Measuring and supporting progress for these students requires exceptionally strong coordination and collaboration between home environments, school teams, and the multidisciplinary therapy professionals involved. This seamless coordination includes conducting regular weekly check-ins to align efforts, establishing unified, measurable goals across all parties, and maintaining comprehensive shared records to guarantee consistent, high-quality support every day. Maximizing both comfort and dignity within the classroom setting is absolutely paramount for the success and well-being of students with profound locomotor disabilities. Essential accommodations include providing specialized seating solutions, dedicated support for private washroom needs with respect and privacy, allowing longer transition times between activities, and thoughtfully modifying activities to ensure full involvement. Peer inclusion is also a vital component, powerfully exemplified by developing and implementing a comprehensive, adaptive inclusion plan that actively fosters a supportive, welcoming classroom environment for everyone. Proactively addressing potential feelings of isolation forms a key aspect of comprehensive social-emotional support tailored for these students. Proven strategies involve publicly celebrating each student's unique strengths and accomplishments, encouraging positive peer mentoring relationships, teaching all about consent-based personal care practices, and consistently promoting opportunities for greater autonomy. As the poignant quote so wisely reminds us, support is most powerful when it truly preserves dignity in every interaction we have. High school students with profound locomotor disabilities consistently demonstrate remarkable resilience in the face of their challenges. Through dedicated teamwork among staff, thoughtful inclusive planning, and unwavering respect-centered care approaches, these students are empowered to truly thrive and reach their highest potential. Thank you sincerely for your commitment to building truly inclusive schools where every single student can reach their full potential with dignity and support.